Yeah, I can add a little bit to that. I think that we basically have an issue of fairness on two levels here, and one of them is the underlying science, okay? And to some extent, the FDA is, the people that the FDA talk to are the people in other government institutions and people from the drug companies, and that's primarily where they get their worldview. You know, scientists and administrators as well, but there's another level of bias on top of that, and that is the political bias within the system. And this is very, very pronounced. And in a recent case, I believe other people may be able to add information about this, where the FDA told Congress, the Hill, that they had very serious safety concerns about one of the rare vegetable oils that contains a substance called GLA, or gamma-linolenic acid. And they were talking about bleeding disorders and convulsions as possible side effects for GLA. And yet, when FDA scientists, under oath, in court, testified about this substance, they said they had no safety concerns about it, and they didn't know of any other scientists who did. So this shows how the political process can corrupt the scientific mission of the FDA. Absolutely.
You agree?
Yes, the Federal Circuit Court, in ruling against the FDA on this particular case, said that the FDA had a Alice in Wonderland approach to the whole issue of regulating. They were arguing that the addition of this substance, this oil, to a gelatin capsule made the oil a food additive, and therefore should be taken off the market.
As an unapproved food additive.
As an unapproved food additive.
Well, I just know that there's a bill up right now that is going to try to make vitamins prescription only.
How do you feel about that?
I think it's terrible. I think it's horrible. It's what they do is they see a profit, and they want to get their hands into it. And there was a study done back east, that a 10-year study that proved that the women taking those supplements had a reduced risk of breast cancer. And I think it's really strange that now that a 10-year study has come out positive, proof positive, that now they're pushing to get their hands into the till. And it's ridiculous. It's absurd.
I would like to talk about censorship, you know, FDA censorship. They basically want to say, you know, what you can say and what you can't say. They already censor the drug companies. Most people believe that because we have the First Amendment, which says, you know, that we're going to have freedom of speech, that means that people can go out and say things that are true. As long as it's true, you can say it. But under FDA law, that is not the case. Drug companies cannot tell doctors or the public about unapproved uses of their drugs. And now the FDA is trying to, in a sense, perform the same kind of censorship on the entire nutrient supplement industry. In other words, if folic acid will prevent neural tube defects and, you know, brain deformed babies, that people can't tell the American public that that is the case. It doesn't matter that it's true. It doesn't matter that you can get, you know, 10 or 100 scientists that will testify about it. It doesn't matter whether the stack of papers is, you know, 6 inches thick or 10 feet tall. You know, until the FDA approves it, you cannot make that claim. And I think this is fundamentally censorship, and that as American people, we should say, no, we don't want that in our government.
Let me just tell you that if you think we're radicals, it's because you haven't had a loved one die yet or you don't have cancer. I just want to establish that these people really do have other things to do today, and the reason we're sitting here sharing this information is because we have a lot of people here that have the information, and I just am soaking it up. And I'd like to go back to you for
Dr. Jaffe, how many years has it been since it's been relatively accepted that folic acid prevents neural tube defects?
The experts in the field say that the data was very clear 25 years ago. And most countries, Western European countries, Pacific Rim countries, have been using folic acid supplementally for high-risk women or for women at large who wish to have a baby for at least 20 years. So it's been a substantial period of time that the science has been clear, and it is only literally this year, 1993, not 1973 or 1968, when FDA has approved that, in fact, there is a health benefit. They've actually approved.
Well, just recently. They denied it in January.
Yes.
Yeah. And what's really scary about this, is that by what you just said, and FDA figures, 2,500 babies every year minimum have been born defective due to this lack of folic acid. That's over 50,000 American children that have been born defective because the FDA wouldn't let that claim out of the bag.
I'm not familiar with how folic acid has been regulated in other countries, but I can tell you what happened here in the United States. Our Public Health Service made a recommendation that women of childbearing age consume 400 micrograms of folic acid each day to reduce the risk of certain birth defects. That recommendation was made last fall. This past June, FDA announced its intention to approve a health claim on the labels of foods and dietary supplements to call attention to the relationship between folic acid and neural tube defects. So the delay, if there was one, was somewhere in the neighborhood of 6 to 8 months.
This past spring, the National Academy of Sciences issued an important report that showed that by the age of 5, the average child in America has consumed pesticide residues above the lifetime allowable amount, according to the Environmental Protection Agency, for not 1 or 2, but often 5 to 10 pesticides from the residues in the food. When Commissioner Kessler was asked about what FDA was going to do about this important, compelling public health food safety question, he came forward and said that FDA would urge the industries to develop safer pesticides. When we look at the relative risk of supplements, where FDA is putting considerable effort and considerable resources to extend regulation and reduce availability, and we compare that with the risk of cancer promotion or the other immunologic deficiencies that can result from accumulation of pesticide residues in the body, there's a clear discrepancy between a compelling public health need for safer food and the way in which FDA is putting resources towards reducing availability of supplements. And it's ironic because in many cases the supplements may reduce the toxic effects or help detoxify the pesticide residues.
Jeez.
People should not think just because on an almost daily basis they're seeing stories about dietary supplements that it's the only issue on the agenda of the Food and Drug Administration. It turns out that reform of federal pesticide statutes is one of the highest priorities, not just of FDA, but this administration, which includes the Department of Agriculture and the Environmental Protection Agency. And we are working very closely with the other agencies, with the White House, and with Congress to try to bring about reform of pesticide laws that have tried and not succeeded for the past 15 years. We think that reducing the risk of pesticide residues to all Americans, including kids, is a very important issue, and we are hard at work at it.